lesion. 36. A 17-year-old male was found to have a 3 cm lytic lesion surrounded by marked sclerosis in the distal diaphysis of his right femur. CT confirmed the presence of a nidus with matrix mineralization and there was no suspicion of other lesions. What is the most likely diagnosis? Osteoblastoma. 37. A middle-aged gentleman who is otherwise well was shown to have coarse, vertically aligned trabeculae on a lumbar spine radiograph. A comprehensive range of blood tests were all normal. A CT of his spine was performed which showed a pepperpot pattern with small dots of high density on axial images. The cortical margins were well preserved. What is the most likely diagnosis? Hemangioma. 38. Which childhood tumor is almost exclusively located in the epiphysis? Chondroblastoma. 39. You are preparing the equipment required to perform a bone biopsy. When would a coaxial, introducer sheathed, needle offer an advantage? To biopsy a deep lesion. 40. A 40-year-old man presented with lethargy and knee pain. A radiograph showed a diaphyseal lesion with bone destruction. What diagnosis would be most likely? Lymphoma. 41. A 67-year-old man was noticed to have a mixed sclerotic and lucent region in his proximal tibia with bowing of the bone and marked thickening of the cortex. There was no periosteel reaction. What is the most likely diagnosis? Paget's disease. 42. A 35-year-old lady with a 2-month history of pain, localized swelling and reduced range of movement of her right knee was shown to have a lytic subarticular lesion in the epiphysis and metaphysis of her distal femur. No surrounding sclerosis or soft tissue swelling was seen. A subsequent MRI showed heterogeneous signal on both T1 and T2 weighted images. No fluid levels were visible. What is the most likely diagnosis? Giant cell tumor. 43. A 38-year-old female presented with a large, destructive giant cell tumor.
What is the most appropriate management? Blood resection and reconstruction with allograft. 44. A 22-year-old man presented with pain and swelling of his right knee having knocked it while playing football. The X-ray revealed a destructive lesion in the proximal tibia with a mixed sclerotic/lytic appearance. A hair-on-end type periosteel reaction was also visible. An MRI showed intermediate signal with foci of high signal intensity on T1 and heterogeneous high signal T2 weighted images. What is the most likely diagnosis? Osteosarcoma. 45. A 19-year-old girl presented with discomfort in her left leg of gradual onset with no history of trauma. A radiograph showed a translucent area with a thin sclerotic